All right, it is your girl M here with Dr. Kara once again of Resilience PT. Today's going to be exciting and a little different because she's going to give us a little bit of a visual of what she actually does, which is very nice because if you want to do a consultation, I think, 90 minutes?
Yes.
The first one, which is very nice. We all know I love quality time and just the thoroughness of these sort of things. And then 60 minutes thereafter?
Yep.
Yeah. So feel free if you want to inquire after maybe watching this session, or you are a person who just wants to invest in self-care and rub those joints out and amongst many other things. So that's why I'm excited, because she's going to give us a visual of the variety of things she does, even though it is physical therapy.
Yes.
Yes. Yeah. How's everything been since the last time?
Great. Yeah. You know, prepping for the holidays. So busy and just trying to stay warm with the 20 degrees outside. But yeah, great. Perfect.
Hopefully not helping the people with the slip and falls putting the lights up.
No, hopefully not. Yeah. Got to waddle like a penguin, as they say. Yeah.
I know. Stay low to the ground.
If we want to be PT technical, widen your base of support because it makes you more stable.
There
so
we
when
go.
You're walking on ice, that's why they say waddle like a penguin.
Okay,
so, yeah.
There you go. So what are we going to do to get started today?
So we're going to start off, I usually have to work my way head to toe because otherwise I usually get super confused.
Yeah, you're processed. I get that. I get it.
You know, you kind of just fall into your routine. So you can go ahead, lay back on your back.
All right.
And do you have like neck tension, headaches, things like that?
Neck tension, yeah, sometimes simply because the work that I do. Oh, let me take off my wonderful see, trying to be fabulous.
I know. It's okay. I'm used to moving things out of the way.
I know yesterday at the chiropractor, I said, let me take these off while he cracks my neck.
Next thing you know, you're missing an ear.
Right.
So this is usually what I would start off with for like neck treatment. This is called suboccipital release. So how I usually describe this is think of like a weighted blanket for people, or like a thunder jacket for a dog. It's a deep pressure that provides like a calming sensation. It tells the brain to relax these muscles. So much like that weighted blanket, it's just a calming sensation overall. Okay. And, you know, it's really relaxing, I guess. You know, you probably felt like a little tension there. But,
yeah. They do that in my, like, massages, too, sometimes.
Yeah. So I love my weighted blanket. It helps me sleep at night. But that's where it's just, like I said, a deep calming sensation. Okay. So now we're just getting into stretching the neck a little bit here, focusing on the upper trap that usually gets tight. And, you know, I just kind of hold here for a little bit. Yeah, and
I'm right-handed, so there's a lot of use on that side, or I'm in the car and my arm is up, you know, not having the phone in my hand, but still, you know, doing something on it, and that tension builds up.
Yeah, and usually, you know, you can kind of feel maybe a little tighter on one side over the other. I usually tell people all the time, like, my test turns into the treatment right away. Okay. You know, it takes me 1 second to evaluate how tight you really are. And then,
to assess kind of how to... Okay.
And then I just kind of hold it here and just let the muscles kind of, you know, relax into this stretch.
I think that's what I struggle with, too, is just the patience and slowing down part of just...
Oh, don't get me wrong. Me too.
No.
But sometimes you get so wrapped up into, like, talking with people. I'm like, shoot, have I been holding this stretch for, like, 5 minutes? No joke, really.
They might have needed it.
Yeah. So this is the muscle called the levator scap, also a very tight muscle up in, like, the neck shoulder area. So I do like to just kind of, like, stretch everything out around the area.
No, I'm feeling that one. That's good.
So then what I might usually do is, it's called contract relax. So it's a muscle energy technique. And so what I'm going to have you do is push your head back into my hand.
Okay.
And then relax.
Okay.
And then we're going to do that 4 more times.
Okay.
So you'll feel as you're pushing kind of like a little bit of like an extra stretch almost. And I really like that because it really helps to just like re-educate the muscles. Just kind of like the different way. See, what's that for?
I think so.
So.
One for good luck.
Right? Again, when I'm talking, I'm like, shoot.
It was good, yeah.
How do you count to 5? But yeah, so that's just a way that kind of helps like re-educate the muscles. And that's what like muscle energy techniques are all about.
Okay. You tell me when to count down.
Yeah. So then go ahead. We'll do 5 pushes this side.
Okay.
Because again, you got to keep yourself even, right?
I know. Oh, yeah. You know I'm all about the OCD.
Oh, yeah. 5. See, I actually can't
okay. Starting off strong. You're getting all my areas already. Oh, boy.
So then I'll go into a little bit of like joint mobilization. Again, usually pretty tight on everyone these days, you know, with that forward head posture, looking down into
these phones.
Technology, we'll say. It's not just the phones, it's the tablets. And, you know, I'm a big reader, so.
Oh, yeah. Did you get those funny glasses yet?
No. Stocking stuffer, maybe? No.
There you go.
Let's see, so you're a little tight right there. Your neck really isn't too horrible, but also you're young, so.
I did just go to the chiropractor yesterday.
That's true, right.
Cheated a little bit.
Yeah, what the heck? All right, so this is something I actually always look for is first rib elevation. And I think a lot of people kind of don't really consider it, but I think you're elevated on that right side. So now if I push in on both sides, do you feel like one side is more tender than the other?
A little bit, the right side.
Yeah. Makes sense. So then that's where I just try and like mobilize it a little bit by kind of just like pushing it down, letting like re-educating those muscles that are tight on that right side, holding it up. So that might be something again where I'll take like your head, stretch out, but push down on that first rib to really get those muscles holding it up.
I feel that.
Yeah.
It's like an alignment for the body.
Oh, yeah.
Ooh. Wow.
So before I continue on with the first rib, I also check out like how your collarbone's moving a little bit tighter on that right side, which makes sense. And then we look at the first rib in the front here too.
Okay.
And any like tenderness there with that?
Not too bad. No.
Yeah, you're pretty good, honestly, in the front. It's more so you're elevated there.
Yeah.
So then a technique I might do, and I'll still do it with the front here, but I'll hold down that first rib, and now we'll do what I call like mobilization with movement. So I'm mobilizing that joint while you're gonna move your body. And again, it's trying to re-educate those tissues how to like function properly, right? So I'm gonna have you rotate your head to the left. We'll just do 5 times, but you'll kind of feel that first rib popping up into my thumb there. And I'm just giving a gentle pressure down. It might not feel gentle.
But you feel it. Like, I feel it almost all the way up here.
Right.
Yeah.
Because you know, like we said last time, it's all connected. That was 5.
Yes.
That's how quickly, like I said, I lose count that quick. So now go ahead and rotate your head or move around and see, like, does it feel any looser at all?
Oh, yeah, a little bit.
Yeah.
Because I guess with the tension I normally have, it's like...
So that's where I try to do that mobilization with movement most, because that is, again, kind of most functional overall. If I just mobilize it for you, that's great and all, but, like, we really need to re-educate those muscles, how we need them to function. You know, we need that to relax while we're tension loading that muscle, right?
Especially with people who like me who don't stretch like I should.
Yeah. We're all guilty of it, I'll be honest, you know.
Yeah.
So luckily, your right side is the tighter side. And I'm just going to stay on this side, obviously, so I'm not blocking people from viewing. So you're lucky you get the good side, the side you actually need work on.
You're right.
So then I kind of go down, work on like, I did feel that. Just like mobilizing again, everything into the body. So shoulder here. And then again, kind of working our way down into like elbow. Moving okay though. Yeah.
Just like I said, just like when you're on a computer all day or like using a mouse or just primarily right-handed.
Yes.
It's like you don't realize, and I have a high pain tolerance.
Yeah.
So I'm like, I know I'm probably in like worse shape than I'm telling my mind.
Well, remember, we're 35 now.
I sent a picture to my boyfriend of like all my supplements. I said, welcome to after 30s.
So that little popping that you feel in there is normal. You have a lot of little tiny carpal bones in there. But again, you don't really have any wrist problems. It doesn't seem like.
Hopefully not.
I was like, oh.
Hopefully,
Are we jinxing it?
No, I work with home care clients, and the one lady, poor thing, her arthritis was so bad she could barely open a bottle.
Oh, yeah.
Please don't ever let me get there.
Again, motion is lotion, right?
Yeah, I like that. Motion is lotion.
Yeah, that's what they preach in school.
Yes.
So. Now getting into more like lower body, back stuff, I always kind of start off with a lot of it is assisted stretching to begin with. And we will get into more soft tissue stuff that I did bring today, but, hamstring stretch, which you're pretty good here.
Really?
I look for about 90 degrees for we'll say functional limits.
I'm not a complete loss.
No. No, there's a lot tighter people. I'm probably tighter, honestly.
Yeah. Wait a minute.
I know.
Well, then again, who's stretching you? Yeah.
Yeah, you're right. It's a good question.
Therapist needs a therapist.
Usually it's my husband.
Yeah.
If I ask, but And so then just making sure like hips are moving good, because I think we talked about last time with your back issue, probably does come from tight hips, kind of like, I'll just say weak core. I don't really like to label that because
I've been trying. I got little weights at home that have stared at me the first year and a half of living in my apartment.
Yeah. They're just a nice decoration, right?
Good weight.
Yeah. So this is the nice piriformis stretch here. This is a stretch that probably everyone should be doing. I'm sure you kind of like feel it in your bottom. This one is really important. A lot of people who have sciatic nerve pain, this is the muscle that's actually kind of tight and can be pinching on that nerve.
Okay.
I will say a lot of people think even like that low back type pain that you're having, it can present similar to sciatic nerve pain, but it's not really sciatic nerve. So that's kind of like the ligaments of the pelvis around there. But again, this muscle still is going to get tight and try and compensate and stabilize that joint. So it is just really important to stretch it out, because
that was important for me, because a girl like me, I like to wear heels. That's definitely contracting that muscle in the back.
Sure. Especially compensating like for glutes and stuff. Yeah, that's
I think it was Dr. Oz, and I'll never forget. He was like, you're going to pay for it, because then you figure when you go to a flat shoe, now that muscle's like, okay, wait, what do I do now?
Right.
And I'm like, beauty is pain. That's so bad.
As a PT, I'm like, no, absolutely. In fact, it's funny. So there's, for the viewers watching, I am mobilizing her knee right now, and now we'll go on to the ankle. But see, this is what happens. We end up talking while I work.
But this is good, because then while you're doing your appointment, it's not so intense.
Time flies. It really does. I'm not kidding. But no, so going off on a tangent about barefoot shoes, that's actually what I like to wear, because there is a school of thought where, not everyone needs arch support. And I will say, like, people who are marketing for that are very good at their job, because that arch is naturally supported by your muscles. So a lot of people who have arch support that don't need it, now you're overcompensating, and your muscles are just getting lazy and tired, and it kind of works its way up the chain.
Interesting.
Yeah.
Okay.
So but that's kind of where, if you're used to wearing heels and then you go to flat, your muscles aren't used to that yet. It's kind of like, we'll say running a marathon without training.
Okay. Gotcha.
But that's just something like I'm very mindful of for people, is like, not everyone needs that arch support.
Yeah.
When I first started working, I would come home like both my ankles, both my knees would be killing me. I switched to those barefoot shoes, and since then they really haven't bothered me too much, because my muscles have now gotten stronger. Or if I go on vacation and I wear supportive shoes.
Yeah, those bother
my
you.
Ankles kill the end of the day.
That's actually interesting, because sometimes if I add support, like my knees and will still hurt, and I'm like, okay, I'm confused.
Yeah.
So that'd be probably because I wear heels so much, my arch is fine, and I might need something like that.
You're like overcompensating by adding support. Yeah.
Interesting. Okay.
So right now I'm working at the hip flexor here. Is it tender for you at all? Yeah, it's like, it's a little tight. So again, I'll just kind of hang out here doing that. It's not a suboccipital release because it's not at the head, but that deep pressure to try and let it relax a little bit. And then once I feel it kind of give in, yours is kind of giving in a little bit right now.
Stubborn.
Yeah. But that's where then I'll switch it into that mobilization with movement, where I'm like trying to mobilize it. I'm going to have you slide that heel up towards your bottom, like by bending your knee.
No.
Yep.
Okay.
And then, so up and back. A little more tender when you do that. So up and back, we're going to do, we'll do 10 times.
Oh, okay.
I know.
2.
As we go through it, it should get a little bit easier. But again, I'm trying to have that muscle relax throughout the range here.
I know, it always amazes me that, like, you'd be surprised. These very small movements are very effective.
Yes.
Oh, no, I'm telling the world how much I really don't work out.
You know what? Even if you did work out, it would still probably be tight anyway, so.
Oh, wow. I think that's the last one. We'll do one more.
I was going to say, see, I stopped counting after one. Although I do tell people, I'm like, I do generally know the time it takes to do 10.
Right.
I'm not counting, but I do generally know.
There was some burn there.
Yeah.
Oh, okay.
So I know last time we talked about a lot of pelvic floor stuff, stretching of the legs, hips like that. I do incorporate into pelvic floor. Obviously, I'm not going to do a pelvic floor like exam on you. But I am going to do like a little abdominal massage here for you, which I also incorporate into my pelvic floor exercise and treatment routine. So I'm just going to like roll that down just a touch. And then what I do, it's called kind of like skin rolling.
Okay.
And so a lot of people hate this because they're like, it makes me feel so fat. But
oh, jeez.
like, it's fine because we all need it. And it's just that soft tissue that's sticking together.
Yeah.
And is that like a little tender for you?
Not horribly, but just a little bit.
I was going to say, you're actually a little tighter more up here than you are down here.
Okay.
And so it does kind of feel like I am just pinching the skin. But what we're trying to do is, again, break up those soft tissue layers that are stuck together. So in regards to the pelvic floor, a lot of people have had abdominal surgery, C-sections, gallbladder removal, whatever. And
kind of changes the original muscle form.
Yes. And those, like, that scar tissue is just limiting in function. And it can pinch down on nerves, which can lead to limitations in sensation as well.
Does that help people with that?
Yeah. Okay. So this is something I really, really focus on that I'm not sure like too many other people do. But I have had people who like I pretty much just like do this and it does get better. So I do try and really advocate to people to, after C-sections, like right away or any abdominal
sooner
surgery,
than later,
do that scar mobilization because doctors will not tell you to do it. And that's really unfortunate because, again, it's...
I never would have pictured PT being this in-depth.
Yeah.
Okay. Education, yeah.
Well, that's why we're here today. But yeah, scar tissue. And I think it's just because doctors, they stitch you up, send you on your way.
Okay, bye.
Right? So they don't see the after effects of what you really need.
Okay.
And you're turning a little peachy there, too.
That's okay.
Again, sorry to make you feel uneven because I don't want to block everyone's view, but...
I'm going to be all relaxed on this side now.
I am going to have you flip over because I am going to look at, like, spinal alignment as well. I might have you take your sweater off for this, though. Because, you know what, I'm just going to lift it up anyway, and this is where usually I'll just be like, it's just easier to take it off.
Right. All right. Okay, so just laying on my side?
On your stomach.
Oh, on the stomach.
Yes.
Oh, okay.
Yeah.
Okay.
So then I'm actually going to have you prop up on your forearms.
Oh, like this? Okay.
Yep. And then I'm just looking at basically spinal alignment here. And especially for you.
It's probably terrible.
It's really not too bad.
Yeah.
But your one vertebrae is rotated to the left. Okay, we got like 2 or 3 rotated to the left there. So again, now I'm going to do a muscle energy technique to kind of help correct that alignment. Sorry, everyone watching. I am going to have to go on the other side, so you won't really see much.
Oh, that's okay.
You're going to lay on your left side.
Okay.
And then I'm going to have you bend your knees so your feet are flat.
Okay.
Yep. Feet are flat. Sometimes, you know
what you mean.
Phrases come right out. And then actually I'm going to have you scooch towards me a little bit. Okay. And then, so I'm feeling for your vertebrae here. And then just relax. I'm going to move your legs here.
Okay.
So I'm trying to find where, like we're at that vertebrae right there. And then I'm going to take this arm, rotate you back. And then I want you to push your bottom into my forearm. and then relax. And then we'll do 4 more of those. 3, 4, okay. And then we're just going to move up to the next segment. So right about there. And again, this is just trying to get, so let's do another 5 pushes.
Oh no, I'm putting my bottom towards you, right?
Yes, so push your bottom out, yeah. A lot of people usually try and compensate with that shoulder.
Right.
But we are just trying to get the muscles on this right side to basically get stronger, be active, to pull that vertebrae back into like a neutral alignment.
Okay.
So now go ahead back on your forearms. And then hopefully everything should look good, which it does.
Okay.
Usually people like beforehand, I kind of say like, oh, is that a little tender? Oh yeah, a little bit. And then I'll do this and then they're like, oh yeah, it's a little bit less.
Okay, right.
So
yeah. And you can probably feel I carry a lot of tension in the lower back there.
Right.
Yeah.
I was actually going to have you stay on your stomach real quick. Because then, something else I kind of do is you can get off your forearms.
Okay.
And the chiropractor might do this a little bit, but they're actually trying to get joints to pop. I kind of usually say, well, if it pops, it needed it, because I'm not really putting enough pressure to make it pop. But again, just mobilizing vertebrae, ribs, just getting everything working right here. And then just kind of going, rocking side to side. It's funny, you're actually a little tighter on that left side up in here.
It's so funny. I'm right-handed, but I carry my bags and purse.
Oh, yeah. Well,
yeah.
see? I can notice these things.
I know, you're good.
Yeah, tell all your friends and family, right? Yeah,
she knows her spots. Don't lie.
Right. So then, yeah, you can flip back over. So then another little tool I use here is like a muscle roller.
Okay.
And again, it's just kind of like, people kind of ask like, oh, is it the same as a rolling pin? I'm like,
kind of.
You can try. Sure. But it doesn't have like the ridges.
Oh, right.
So I think that's where you get a little grippy.
Yeah.
To kind of like help massage out the muscles.
Yeah.
So I'm going to have you bend this knee up. And then all I really do is, again, just trying to like roll things out.
Yeah.
And I just say it's kind of to help re-educate the alignment of the muscles, help the blood flow to the area.
Okay.
Keep them loose.
Yeah.
Going back to pelvic floor, a lot of these hip muscles and thigh muscles are tight.
Yeah.
So it is important to actually keep those loose as well.
I was going to say, even that muscle right there, that's real tender.
Yeah, that's usually the one people ignore.
Yeah.
And that's why it's usually tight.
Okay.
And compensating for a lot of issues. Also, the IT band on the outside here is usually a good tight one.
Okay.
And people are always like, well, I can't do this on my own at home. And that's where I would tend to disagree, because you can go out and buy one and then they're like, yeah, but I'm not going to be able to reach laying down. And I say, but you can sit on the edge of the chair, can't you?
Right. Yeah.
Now, an alternate to this is a foam roller.
Okay.
I will say with the foam roller, it is a little bit more coordination, core engagement. It is a little bit more advanced. Plus, now you're doing it against weight bearing, because your body's into it.
Right.
So it is a little bit more intense.
Yeah.
So that's where I kind of say, like,
build up to that, maybe.
Yeah. You know, do what your tolerance is. You might want to start here.
Okay.
2 to 5 minutes a day. Nothing crazy. That's really all you need, just to kind of help, again, mobilize those tissues.
Okay.
So, nothing too crazy.
Yeah.
All right, so I'm going to have you sit up and then just sit, you can sit actually facing that way first, because then I do look at, we'll say, again, just like spinal alignment here.
Okay.
Which you're looking pretty good. But, let's just say you were rotated like this way. I mean, that's...
Okay, maybe, yeah.
This is an exaggeration.
Yeah.
But then I would just try and, work on, let's rotate you back this way, do some like mobilizations, spinal mobilizations like this, maybe even work on some like scapular mobility here, which you probably do need this, especially with that first rib elevated on that right side. So,
and just that consciousness of like, when you're on the phone, when you're working, it's just like, okay, head back, shoulders back,
Yeah, see, I can actually do this side. Keep your even for this at least. Yeah, but not moving too bad.
Yeah.
So then something too that like I might do during my sessions. So I have like little cupping things here.
I've always heard of this, but I have no clue.
Yes. So basically what it does is like it just kind of like sticks to you. So yep. There we go. So then you can see how it pulls my skin up and away. So it's supposed to help like blood flow to that area.
Okay.
Obviously there's different sizes. This one's a little bit bigger, but there's no way that would stick on my forearm.
Right.
So then you just kind of like let it hold there for, a couple minutes, whatever. And then at the end, it's just, I'm not going to have too big of a hickey because I didn't leave it there for too long.
It was her.
Yeah, right. It was the cups.
And then, so what's the benefit from this?
So yeah, again, it's to help stimulate blood flow, release some toxins in that area, separate that soft tissue, get things moving a little bit better. I will say I'm more personally a fan of like the gua sha stone.
Okay.
But that's something where, let's say for the day, you're like, I really want you to scrape up here, which, I'll show that. But, I'll be like, but, your back's still a little tight.
Right.
So, hey, why don't we, we'll turn around and actually we'll show them. So like, hey, why don't we cup your back while we do some scraping up top.
Okay.
Right? So that's where I'll just kind of like put this on your back here. And then that way we're still getting that blood flow, still getting that soft tissue separation up here, or down there rather, while we're still working up here.
Okay.
So since that left side's tight, I'm actually going to give this left side some love here.
Okay, right.
So I do bring like a little towel that way.
Okay.
I don't get anything on your clothes. No guarantees though, it gets a little messy.
That's okay. And what is this stone?
So this one is actually so it's a gua sha stone. A lot of people think to use it like on their face.
Oh,
to help.
okay.
I think it's like to drain lymph or like, that fluid from their face. People think it's going to help make their face look thinner. But if you do look it up on Wikipedia, Wikipedia, the source of all good information.
Sheesh, yeah.
There is kind of the traditional Chinese practice or Asian practice. Honestly, I'm not sure where it originated from, but it does help to break up this soft tissue. And again, I feel with this, I can get a little bit deeper than what the cupping can.
Okay.
Of course, in PT, I don't necessarily call it gua sha, let's say, but more so like instrument-assisted soft tissue mobilization. You probably have also heard potentially of Graston.
That's the one.
Yes.
Okay. Is that like a metal tool?
Yes. So
I did that once. Oh my! I look like I got domestically abused after.
Yeah. So it's literally the same thing.
Rough. It was like this feels nice because you're doing it by hand.
Yeah.
But that thing that was a bit much from like
for
I'm
you
tiny.
Personally?
Yeah, just like thin skin or whatever. Whatever the case is. Yeah, that was a little brutal.
Yeah. So like I said, this is literally the same thing.
Yeah.
Just. In the PT world, Graston is a technique that you have to technically go and be certified in.
Right.
But that's not to say that, like, every PT can do instrument-assisted soft tissue mobilization.
Yeah.
It's just, quote-unquote, the Graston technique.
Yes, yeah.
So, I'm a little hesitant to call it the Graston technique because I don't want to, step on anyone's toes here, but...
And there's a little difference. In it, so yeah.
But it's essentially doing the same thing.
idea, right, right. This one I like because it's not so harsh.
Yeah. No, that's funny because, like I was going to say, so this gua sha stone is actually one a patient gave to me because she's like, the one you used looked like a shark tooth where I wanted to give you a nicer looking one. This one looks like a butterfly. So.
Thanks.
Yeah, I mean, that's pretty much like, this is like one of my favorite things to do.
Yeah.
Because I do find it to be really effective. And again, it's helping to re-educate those muscles and those soft tissues, how to, stay in the place that we just worked them to be.
Yeah.
And that's a lot of, what PT is all about is just like, we can put you back into place, but if the muscles aren't re-educated, if we don't even send you home with even just a couple stretches to help maintain, then what are we doing, right?
Yeah, and I know sometimes too, it's like I can't tell if the pain, like you said, is in the joints or the muscles, but like you said, it could be both or one or not the other,
Right.
Yeah. Okay.
I guess for time's sake too, we'll do this other side as well because we can't. With this, I really feel like you'd feel so uneven. Yeah. But plus that right side, like you said.
Okay, so now what's your thought process on acupuncture?
I really don't know too much about it. Okay. I do know it's, you kind of got to go for a couple weeks or months or something like that.
For it to be effective, right?
Yeah. But that's where I'm like, so I feel like I can't really give a good opinion on it because I'm not too well versed in it.
I did it like once, but like, yeah, the guy looked at me, he was like, oh, you got a lot of tension. And like, I probably had to come back 10 more times just to get back to normality.
I mean, sometimes you got to think like that Eastern medicine, like, it's been successful for this long.
Right. There's something, right?
Something to it, but, maybe because they are getting to the root of the problem.
Yeah.
But, and I think from my understanding, they kind of put it in, we'll just say trigger points, so muscle knots.
Okay.
And again, I could be totally wrong, so please don't come after me. But, trigger points go from being latent, so basically like not really, they're there, but it's not causing you a problem.
Oh, okay.
To active, where it's like, sometimes where you're like, oh, it's just aching so much right here. That would be an active trigger point. Mm-hmm. And so does acupuncture get rid of those trigger points themselves? I don't really know the answer to that, but I always kind of tell people, like, unfortunately, your body does remember old bad habits.
Yeah.
And I usually kind of say this more so at, like, discharge, let's say.
Yes.
Because, like, everyone's always like, are these lifelong exercises? And I'm like, well, shouldn't you be exercising?
Right. If you want to, not be dead by 60 or can't open a jar.
Yeah, with your arthritic arms and hands.
And it's funny, too, because it's like, we maintain our car. We get and it's like, well, we should do the same for our bodies.
Exactly, yeah. Yeah, and I feel like that's something, too, where... again, I think people think like, oh, physical therapy, I got to go twice a week or 3 times a week. And I'm like, I really don't do that. I'm like, honestly, it's...
Too much of anything isn't good.
Yeah, like I'm like, for especially like the amount of time I spend with you, I'm like, it's self-care. It's like,
I know, this is like kind of relaxing. I feel like I'm in a little spa. Well, so I actually used to be a chiropractic assistant. Yeah. And even with that, like this is probably my 2nd month in a row, but I said, I got to put something on the calendar so I can like actually go, but I wouldn't do chiropractic more than once a month for me. Right.
And it's maintenance.
Yeah, and then it's just like a balance of like the chiropractic, maybe something like this, and like a massage.
Right.
Just because I do a lot.
Exactly.
My name is Emily. I'm a workaholic. Really? I don't know when to sit down. Oh, it hurts. Let me do more. Let me get up and do something else.
So you did break up a little bit here, like how you were saying with the Graston.
Oh, yeah.
And so that's where I usually tell people are usually like, yeah, that's fine. Yeah. And I'm like, it's always the like significant others that are always like, oh my gosh.
She hit me.
Yeah, what did she do to you? It's like, yeah, that's normal. Don't worry about it.
I'm so fair-skinned. I bruise so easily as it is.
Yeah. So I usually just say, like, you can expect to be maybe, like, a little tender there for about, 3 days or something. Nothing too crazy.
Yeah.
But that's basically, it'll be there. But, that's not unexpected, we'll say.
Yeah, naturally. Well, this was amazing.
Yeah.
Thank you so much.
I hope you feel looser.
I do. I went to the chiropractor yesterday. Now I have this.
So you scheduled that perfectly for yourself.
What's crazy, and what's funny is we had to reschedule. So everything always works out.
Exactly.
So no stress.
Yeah.
So yes, this is Dr. Kara. I personally will be investing in myself and at least doing this once a month. I know it's funny, but it's actually not, because I said, yes, I am only 35, but I put a lot of strain on my body. I do. I push past the pain a lot. For whatever reason, I carry the most tension in my lower back. And a girl loves heels. So with all that being said, it really is important to maintain this body that we have. as of now, I'm passionate about understanding it because I do home care.
Yeah.
You know, so I've worked with, you know, not so old people to old people who have, yes, underlying health conditions, but also health conditions that probably could have been prevented with a little better maintenance.
Starting at 35.
Yeah, maybe even 30-ish. So everybody who consistently works out and does Pilates, good for you. I'm getting there. I got a mat, so that's a start.
Yeah.
But yes, if you have any interest of setting up a consultation with Dr. Kara, she also does mobile visits as well, so it can't get any more convenient than that. And she is the owner of Resilience PT, and I will keep you updated on how much better I'm feeling when I do sessions with her.
Perfect. Yeah.
Yes,
Awesome.
Thank you for joining me again.
Yeah, of course. I appreciate you taking the time to have me back.
Absolutely.
I love it.
Stay tuned, subscribe, and support local.
Bye.